Morning. Good afternoon. Where are we? Good afternoon. As of this morning, as of this afternoon, we have 7 positive cases of COVID-19, and we have some additional presumptive cases. I have a number of announcements today. Along with Mayor Lang of Hamden, Mayor Bronin of Hartford, Mayor Ganem of Bridgeport, I signed an emergency order in response to the rapidly growing COVID-19 pandemic. This emergency order will prohibit gatherings of more than 10 individuals. The New Haven order largely mirrors Governor Lamont's previous order limiting social and recreational activities to 50 people, but it reduces that total number to a maximum of 10. Social gatherings in the order include, but are not limited to, community, civic, leisure, and sporting events, parades, concerts, festivals, movie screenings, plays or performances, conventions, or similar activities. Our cities and our state are working together, and I'm deeply appreciative of the partnerships. Given my conversation with other municipal partners yesterday and today, I anticipate more will issue similar orders this afternoon and in the coming days. I also have amended my previous order regarding the closure of child care providers to add, in addition to the exemption for public health care workers, an exemption for first responders. A couple of other updates. School food distribution continues to go well. Again, we had a significant increase from the day before in the number of families that are coming to our schools to pick up grab-and-go breakfast and lunch. Yesterday we had 2,267 individuals for a total of 4,314 meals. Our nursing team is up and running well, and now if someone needs a prescription and does not have a healthcare provider, our health department can now do this. Our call system for our nurses is also being improved so that our nurses can distribute away from each other and not be in one central location, so that we can protect our nurses and reduce the likelihood of spread in our own operations. I'm encouraging New Haven residents, if they have a fever and a cough, to call the health department hotline. If you have a fever and a cough, call the health department hotline, which is 203-946-4949, 203-946-4949. I want to take a moment to talk about Career Regional High School. There's been some concerns in the community about this site. And I want to say a number of things about this site. So the site is the only identified regional emergency shelter in New Haven. The site was identified years ago through a process in collaboration with our federal, state, and local partners. This is the site that we need to use as the emergency isolation shelter. By ensuring that people are experiencing homelessness have a place to go to self-isolate, we will be protecting the community. There's been some concerns, particularly in the community around the school, that this may increase the risk to them of potentially catching COVID-19. That is absolutely not the case. We will have security round the clock at the site. People will not be allowed to leave the site. We will have nursing staff on site. This will dramatically increase our ability to protect all New Haven residents, including the residents around this facility, and reduce their likelihood, anyone's likelihood of catching COVID-19. And let me explain why. If we don't have a place for people that don't have a home to go, they will go anywhere. We don't know where they will go. And they will spread this disease to other people in the community. They may bring it back to a shelter. They may bring it back to other places anywhere in our community. We must have a place for these folks to go. This is the site.
What about the homeless people that's not infected?
I'm happy to answer questions in just a second, so if you just hold on. Strong School will be the new site for food distribution. There are also 3 other schools in the Hill neighborhood that currently are operational for school food. Strong School food distribution will happen on Monday. And I just want to finish by saying that I've heard a lot of concerns from residents, and I hear people. I hear that people are concerned about this site being in their neighborhood. I hear that people are concerned that there's a lot of social services in the neighborhood, and it's time for other places in the city to take on more of their responsibility. I hear that, and I agree. But we don't have time right now to wait. We don't have time to argue. We need to look at the examples of other communities that are 11 days ahead of us in this experience, where emergency health providers can't cope with the number of people that are sick. They are making decisions between different people that both need significant medical intervention and are deciding on ones that they can help and ones that they can't help because they did not act quickly enough. This is not the time for our community to argue. I am not perfect. My staff is not perfect. We're going to make decisions that are not perfect. We don't have time for perfection. We don't have time for disagreement. We must work together. I'd like to open up to questions.
Now, the Board of Ed has criticized you, I don't know if it was a communication issue as far as the location of this self-isolation place for homeless people that may contract COVID-19. Was this a communication issue, or was it, what happened there? What's the tension there?
So I can't speak on behalf of the Board of Education. This is a very fast-moving situation. You all have experienced the escalation every single day of this situation, and we are doing our best to communicate with our partners as quickly as possible. We have been communicating with Dr. Tracy. We have been communicating. I spoke with the with the Board of Alders leadership yesterday before this was announced. My staff members spoke on the phone with Alder Hurt, who is the alder in that ward. And we are doing our best, and the Board of Education was noticed before the press conference yesterday that this was the site that we needed to use.
What is the timeline now for the setting up of this site, and could you speak a bit more about what staff will be at this, or what personnel?
So I have no further updates on the timeline since this morning when you and I talked. As we understand what the timeline is, we'll share that with you, absolutely.
And staff, do you have any updates on who will be?
Nothing additional from what I've already given. You had a question,
yeah,
sir?
So you said the school is going to be used for the homeless people that are infected, but the people that are not infected that are homeless are being pushed out of the shelters. I know because I'm one of them. Mm-hmm. I've had your hospitals turn me away after I told them I felt homicidal, suicidal for various reasons. There's nowhere for the homeless to go. All you're going to do is give a spot for the infected homeless and put guards there. That essentially does nothing for the people that are still going to have to be out here 24/7.
I hear you. So one of the issues that you highlighted, I think, very well, is that the homeless shelters have a capacity issue, and also we need to make sure that there are not too many homeless individuals close together in a shelter, because they could potentially...
Capacity. I said the fact that they're turning people away, whether there's a bed or not. They turned me away when there was empty beds.
I appreciate it. Let me finish my sentence, and then if you want to follow up with an additional question, I'm happy to answer that. We have rented hotel rooms to allow for the shelters to have additional capacity and make sure there are not many individuals that are in tight quarters.
I was there. They said the hotels will be for the elderly.
So I'm happy to talk with you offline and get more information on what they're saying to you.
Because something that people need to know, because we are the people.
I appreciate that. I don't have an answer for you about what someone told you.
Sir,
I need more information on that.
Excuse me. How do I find out where I can see?
I'd ask you to reach out to a shelter.
Yeah, I went to a shelter a couple days ago, and they turned me away, and I had to go tell them that I was suicidal so I could get a couple days.
Grand Avenue, right?
But they booted me out this morning, so.
I'm happy to talk to you afterwards.
All right, thank you so much.
Yeah.
Appreciate it.
So Mary, Connecticut has been identified as a state that has a shortage of hospital beds. And I know now that we're in the middle of a pandemic, there are people that are concerned about the lack of hospital beds that are going to be needed for the widespread. Are you prepared to deal with the overflow of hospital beds that are going to be needed in this area?
I don't know what information you're looking at. I would presume that every state has not enough hospital beds. and we are in conversations with the hospital about that very issue. We are working to get estimates on how many beds we may need. Again, this is a regional question, but to your point, Connecticut needs to make sure that we have hospital beds for everyone. If you look at what's happened in other sites like Italy, they have had an extreme shortage, not just of beds, but of equipment. This is very concerning to us, and we're working on to try to address the issue.
So Mayor, have other sites in the city at all?
Hey folks, I'm going to stay until every question is answered, but I'd ask people to be respectful of the person that's answering a question. If you have a question, I'm happy to answer that for anyone here, but just take your time and please be respectful. Sorry, go ahead.
Have you identified potential locations in New Haven? I know that Mill Regional is for one specific population, but are there other sites that you're looking at potentially for overflow of beds, whether it's Yale, whether it's schools? What are you looking
I don't have an answer yet, but that is a question that we need to address, and we're working on that.
Mayor,
Mary Lou.
have the hotel rooms been opened? I mean, 24 people.
My understanding is that they've reserved the hotel rooms. I do not know yet if they have people there, but we will know that soon.
Do you know if there is an overflow? I mean, are people being turned away because there's just not enough?
I will look into it. I don't know.
Do you know where I can find one of the homeless advocates that's usually on the news?
The gentleman here had a question, and then I'm happy to come back to you. You had a question, sir.
Sure. How many times is there a tube sock on any block?
I'm sorry?
A tube sock on any block?
I don't know how to answer that question. I'm sorry. Go ahead, sir.
So I know usually when we say that we're out here in the fight to combat homelessness, that there's usually a homeless advocate that's usually on the news. I'm just wondering, because I'm homeless and I never meet none of these people. I've never met none of these people. I'm just wondering if you can point me in the nearest direction to one.
I'm happy to connect you with the individual that works in City Hall that works on issues around homelessness.
Thank you, sir.
Does anyone else have a question?
One last question. I know that we've seen a lot of closures slowly as we prepare to combat this. Is there any thought still on a possible shelter in place? Is New Haven on track for that, or?
We've had a lot of conversations about shelter in place, and to be frank, some of us, in our internal conversations, are saying it's only a matter of time before we do this anyway, before everyone does this. My sense is that our regional partners and we are not quite ready, but I do think that is on the table still. Our approach with other mayors today, with the order to limit gatherings to 10 people, is a step in that direction.
I have one more question.
Mr. Breen, first.
Has the city considered using the Armory on Goff Street in any way to help provide overflow shelter?
I know that we're looking at a lot of options in our team, and I'm not aware of that, but it's possible that we're considering that option because there's a lot of people in different parts of our team that are looking at different possibilities.
And could you tell us a bit about the 3 new cases of COVID-19 in New Haven? Are they currently isolating at home? Where did they contract this disease based on your information?
Yeah, sure. So I'm just going to practice social distancing here. So currently we have 7 known cases. They are all being monitored closely. It's important to note that the cases are varied from different ages, youngest being 29, the oldest being in their 70s. And so it's important that as we're preparing for this, that individuals make note that this can affect anyone regardless of age and risk factor. It's community spread. Some of the cases were not at all associated with traveling outside of the city. They were within the city, but it spoke to someone locally. We have 2 presumptive cases that we're monitoring and awaiting lab results. While we have 7 cases, we know that these are underreported because we have to await the results to come in from the different laboratories that are providing testing. And so while I'm saying 7 right now, we know that that's not an accurate number, and the number is changing daily, and we'll report to you as the numbers increase. As the mayor has mentioned, we want to continue to practice social distancing. It's really important that we maintain 6 feet apart. If we're sick, we really want to try to remain home, and also ensure that we are practicing the executive orders that have been implemented by the mayor so that we can ensure that we can mitigate this outbreak as much as we can.
And apologize if I missed this, but the 3 new cases since yesterday, are they in the hospital? Are they self-isolating at home? Is it a mix?
So you have a mix of the two. You have several that are in the hospital and 1 home recovering.
I just have,
So you have 2 in the hospital, 1 in the house recovering.
this might be a question from the mayor, but University of Bridgeport has offered its facilities for an overflow of hospital patients. Any of the colleges in New Haven offering that at this point?
The short answer is no, but we're in conversations with them.
Okay, may I go, sir?
Yeah, and wait, let's do your last question, and then I'm happy
I actually
to
have quite a few.
go for it. Let's give you, maybe you could do one.
I'm concerned about me and my homeless friend. Number 2, is this biological for one, right? Is this like something that came from another country that they put out to kill us, to kill mankind? Because first of all, you said there's only 7 cases here. I don't believe that none of us here are infected. Right? If it's only 7, how many millions are here in Connecticut? I mean, like, what am I supposed to do? Am I supposed to sleep on the green? If I get sick and infect everybody that I come in contact with, I'm not sick and I'm far from it. But I don't understand how we can get shuffled. You guys have homes to go to, you have jobs. I'm sorry if you did get laid off or whatever happened, but we have nowhere to go. Okay?
I think, let me respond to your question. This is going to be the last question. I think the gentleman raises an important issue about who gets infected. It's important for us and me to reiterate that because there are 7 positive cases that have been tested, that doesn't mean that none of us are positive. It doesn't mean that there are many community members that are not already positive. We just haven't tested them. And so as we start to test people, we anticipate that number to quickly rise, as we are seeing in the rest of the state of Connecticut. But some additional information is coming out about the virus, and that is that middle-aged people also can be significantly impacted from a health perspective. And so what we have been saying, and many people have been saying around the world up until recently, is that it's primarily seniors and people with medical issues that have serious issues around this virus. What appears to be happening is also some middle-aged people are also significantly impacted by the virus. I think that's important for folks to understand and know. That's going to be my last answer, and thank you all for being here.